Good afternoon, guys. Good afternoon, guys. Welcome to part two. This is Dr. P. This is part two of stroke diagnosis and treatment. So today we are discussing about the treatment of stroke. So we have two type of stroke. We have the ischemic stroke. We have the hemorrhagic stroke. So it all depends on the type of stroke the individual has. So based on the type of stroke, that depends on the type of treatment we're going to give. So first today we're going to talk about the ischemic stroke. Ischemic stroke is when there's a blood clot in that part of your brain. It could be a blood clot in the carotid artery leading to stroke, so or a blood clot in that portion of your brain, in the blood vessels of your brain. So what are the treatment of ischemic stroke? So that's why when somebody has a stroke, you can revive you can revive the symptoms of stroke immediately within 4.5 hours or within 3 hours, so that it can give you an emergency IV medication within 3 hours or four before the brain tissues of before there's a death to the brain tissues. So that's why it's very important for you to come to the emergency as soon as somebody has a stroke. Call 911. So we usually give them emergency IV medications. So this is given through the IV. So this drug can break up the clot within 4.5 hours from the time the symptoms started, if given intravenously. So the sooner the drugs is given, the better. So quick treatment not only improve the chance of survival, but it may also reduce complication associated with stroke. So what are the medication? The medication is known as TPA. That's an IV injection of TPA. That's a recombinant tissue plasmid activator. So it's also called the Activis or Artemis. So it's a gold standard treatment for ischemic stroke. So when you inject this thing through when you inject the TPA through the IV within 4.5 hours, it's usually given through the veins in the arm within the first 3 hours. So it can also be given within 4.5 hours after a stroke has emerged. So this drug will help to restore the flow of blood by dissolving the blood clot that is causing the stroke. So it's very, very important and for you to bring such individuals to the hospital. Call 911 as soon as you know somebody is having a stroke, so that they can deliver TPA through the IV to break up the clot within 3 hours or 4.5 hours of stroke symptoms. They also use what they call the emergency endovascular procedures. So they can use it to treat ischemic stroke because this can go directly inside the blood vessels. So it has been shown to improve the outcomes and reduce long-term disability after ischemic stroke. So, as we said, emergency endovascular procedure they can use to develop the medication I just discussed about. That's the TPA. So it's a catheter whereby a catheter is threaded through your groin area. That's in your femoral artery. So it's threaded through your groin area, then straight to your brain to deliver the TPA directly to where the stroke is happening. So as we said, the time window for treatment is somewhat longer than that. Is the time window for treatment is somehow it's longer than that of the time for that of injected TPA, but it's still limited. Then also you can also remove the clot using a stent retriever. So thereby the doctor have to use a device attached to a catheter to directly remove the clot from the blood vessels in your brain. So this procedure is very, very beneficial for people with a larger clot that cannot be dissolved by the TPA. That's why they use a stent retriever. So it's often performed in combination with injected TPA. So there are other procedures you can use. This other one is known as the carotid endarterectomy. So carotid endarterectomy is very important. That's the carotid arteries are the blood vessels that run on inside of your neck, supplying your brain. Those are the carotid arteries. So this surgery have to remove the plaque that is blocking these carotid arteries, and that will reduce your risk of ischemic stroke. So a carotid endarterectomy involve risk, especially if people with heart disease or other medical condition. They also have to use, on that procedure, they also use the angioplastic intent. In an angioplastic, a surgeon thread a catheter to your carotid artery through an artery in your groin. A balloon is then inflated to expand the narrow artery. So this stent can be inserted to support the open artery. So thank you very much. This is the treatment of ischemic stroke. So this is Dr. P. Don't forget to subscribe to this channel. So we're going to go to the next part 3 for the treatment of stroke. This is going to be touching on hemorrhagic stroke. That's when there's a bleeding in the brain. Thank you very much. See you next time.